Hi friends, welcome to Interactive Medicine. In this section, we are continuing our part 2 of the central nervous system, and the topic is anti-epileptic drugs. And basically, the seizures. Seizures are caused by abnormal electrical activity in the brain. Epilepsy means a neurological disorder which is marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with the abnormal electrical activity in the brain. And we have basically two types of seizures. General seizure, which means that all of the brain is affected. The person is unconscious in this time. In focal seizures means a particular area of the brain is affected. The patient is fully aware or maybe unconscious. So here we can see a neuron, and the neuron, I already said that it is the abnormal excitation of the neurons. So here is we here we can see a presynaptic neuron, and here we can see postsynaptic neuron and its turn rate. From the excitatory neuron, the neurotransmitter is glutamate, and it is secreted into the synaptic vesicle, and it binds with some receptors. This blue one is known as NMDA receptor, and this one is known as AMPA receptor. I will tell you later. And these receptors allow the sodium and calcium influx. So we have inhibitory synapse there, and it allows chlorine influx. I will discuss this topic on last class about the hypnotics and anxiolytics drugs. I said the barbiturates and benzodiazepines, its mechanism. You can watch that. Okay. Sensory synapse, but now I am focusing excitatory synapse. Then inhibitory synapse I will tell. Then excitatory synapse. What happens actually is here. Here is the dendrite of presynaptic neuron, and sorry, here is the axon, not dendrite, axon of presynaptic neuron, and dendrite of postsynaptic neuron. Dendrite of postsynaptic neuron. Okay, guys. In normal state, a cell, a neuron, have more positive inside of the cytoplasm, and more negative inside of cytoplasm and more positive outside of neuron. And at the time of action potential occurs, the depolarization happen, then action potential generates due to the influx of Na plus. So influx of Na plus leads to changing its polarization. Positive come inside, positive charges, more positive charges inside, and this allow the action potential, and it propagates along the neuron, and it transmit to another neuron. So if this is an abnormal condition, it may leads to epileptic condition. We have another channel, that is heavy voltage gated channel. Heavy voltage gated channel. Heavy voltage gated calcium channel. This is a calcium channel. Heavy voltage gated calcium channel. This channel allows the entry calcium. What is the function of calcium here? Actually, we have the excitatory neurotransmitter. Excitatory neurotransmitter glutamate. Excitatory neurotransmitter glutamate. Glutamate are stored in the synaptic vesicle. Here is the synaptic vesicle. So this calcium is going to be release of promote the release of GABA, glutamate, going to be release of glutamate into the synaptic vesicle. Okay. Synaptic vesicle. In postsynaptic neuron, we have some receptor, namely known as AMPA receptor and NMDA receptor. This is AMPA receptor. Okay, this glutamate is binding to AMPA receptor. AMPA receptor, and leads to the influx of Na plus. So in postsynaptic neuron, it gets an stimulation, so it's inside become positive, so action potential generates and it propagates along the neuron. We have another receptor here. The glutamate is going to bind this receptor. This receptor is known as NMDA receptor. NMDA receptor. So this receptor allow the influx of calcium. So along with sodium, we can see calcium also give positive charge. So there is one more channel we have, that is known as T-type calcium channel. T-type calcium channel. T-type calcium channel. Okay, this is how the excitation works. So abnormal excitation of neurons leads to epilepsy. So in normal body it won't occur because of the fact that we have inhibitory neurons near the postsynaptic neuron. We have, this is neuron, inhibitory neuron near to postsynaptic neuron, and it secretes GABA. It secretes GABA. So we have a receptor here. That receptor is known as GABA A receptor. GABA A receptor. You can watch about this mechanism in last my video. GABA A receptor. So the GABA is bind to GABA A receptor. It allows the entry of the chlorine. It allows the entry of chlorine. So it becomes negative. That's how our inhibitory neuron, our brain system, our body regulates this regulates the excessive excitation. And this GABA is degraded by excessive GABA can be first reuptake by we have a special receptor here or special channel, a transporter. It's not a receptor, it is a transporter, known as GABA transporter. GABA transporter. Okay, it get into the cell, into the neuron, and it becomes degraded by some specific enzymes known as GABA transaminase. GABA transaminase. Okay, and this is how GABA is going to be degraded. So this is the principal mechanism. If you know this mechanism, you can get into pharmacology section of this video. And if you don't know, you can look into once more this section. That is here is our presynaptic neuron, and action potential generates by sodium channel, heavy voltage gated channel. Calcium will leads to the release of promote the release of glutamine from the synaptic vesicle. Glutamine in synaptic cleft. So glutamine bind to AMPA receptor and promote the entry of Na plus and NMDA. Glutamine binds with NMDA receptor. It promotes or it allows the entry of calcium 2 plus, and we have T-type calcium 2 plus channel. It also allows the entry of calcium 2 plus, and it is inhibited by inhibitory neuron which is near to postsynaptic neuron dendrite. It release GABA. GABA bind with GABA A receptor. It allows the entry of chlorine. It changes the polarity inside the cell into negative, and GABA is taken by GABA transporter, and it is degraded by gamma transaminase. So we are going to discuss the drugs. So first we are going to discuss the drugs which blocks Na plus channel. Voltage gated sodium channels are blocked by valproic acid, topiramide, carbamazepine, phenytoin, oxcarbazepine, lamotrigine, zonisamide. And we are going to study next gated channel blocked by heavy voltage gated calcium channel blocked by lamotrigine, topiramate, gabapentin, pregabalin. Another T-type calcium 2 channel can be blocked by ethosuximide, zonisamide, valproic acid. Valproic acid can be given in the case of epilepsy with a depressive reaction. Next we are going about a special drug, levetiracetam, which is bind with a protein present in the synaptic vesicle. I will draw here. In synaptic vesicle there is a protein known as SV2. So the drug levetiracetam going to bind with SV2 protein bound and inhibit the release of glutamine from vesicle. Levetiracetam going to bind with SV2 and prevent the release of glutamine from synaptic vesicle. So we can block the glutamine into the synaptic cleft. Then NMDA blocker known as felbamate prevent the calcium entry. Felbamate, NMDA blocker. It is an NMDA blocker. Felbamate is a NMDA blocker. It prevents the calcium entry. Then benzodiazepine and barbiturates. It's bind with the GABA A receptor, which allow the entry of, sorry, it's not calcium, it's chlorine. It's chlorine. So we have barbiturates, and benzodiazepines, which promote the entry of chlorine. And we have thiagabine. And also I want to say that the AMPA can be blocked by these AMK voltage gated sodium channels can be blocked by valproic acid, topiramate. So AMPA also can be blocked by these channel blockers, valproic acid, topiramate, etc. So next our focus is the GABA transporter blocker. That is thiagabine. It prevents the GABA reuptake, so it increases the availability of GABA neurotransmitter. It blocks the GABA transporter 1, and we have another drug which can destroy this enzyme, or sorry, inhibit this enzyme. This enzyme known as GABA transaminase. The drug are going to inhibit this enzyme known as vigabatrin. The adverse effect of this drug is vision loss. Then these are the epileptic drugs. So side effects of anti-epileptic drugs: hyponatremia caused by carbazepine, oxcarbazepine. Double vision can be caused by vigabatrin. Loss of vision caused by vigabatrin, and double vision caused by lamotrigine, phenytoin. Additionally, phenytoin can cause hirsutism and gingival hyperplasia. Cognitive problem can be caused by topiramate and tonisamide. Additionally, topiramate cause weight loss. Weight gain can be caused by valproic acid. Here, valproic acid and gabapentin and pregabalin. Peripheral edema can be caused by gabapentin and pregabalin. Liver toxicity caused by felbamate. Aplastic anemia. Felbamate can cause aplastic anemia additionally. Then felbamate and valproic acid cause liver toxicity. Then we are going into question. A patient has recurrent attacks of epileptic seizures. Stay unconscious between them. In order to stop convulsions, the drug of the following group should be used in the first place. Tranquilizers, diazepines, lorazepam we can use. A patient has developed status epileptics. What medicine should be used in the case to stop the seizures? It is diazepam. Status epileptics means a single seizure lasting more than 5 minutes or 2 or more than seizures within 5-minute period without person returning to normal between them. A patient's epilepsy and depressive reaction has been administered a drug that reduced epilepsy manifestations and improved the patient's psychic condition. And epilepsy with a depressive reaction, and the treatment is valproate. So valproic acid. A patient present with a dysfunction of cerebral cortex accompanied by epileptic seizures, he has been administered a biogenic amine synthesized from glutamate and responsible for central inhibition. What substance is? Central inhibition is caused by the neurotransmitter GABA aminobutyric acid. Okay friends, I think this video is helpful for you, and I wanna say last thing, the excitatory synapse, glutamate release, entry of sodium and to cause depolarization. Inhibitory synapse, entry release of GABA leads to entry of chloride ion, leads to hyperpolarization. And the grand mal epilepsy, which means that general epilepsy, the treatment is combinative treatment, valproic acid, carbamazepine, diphenide. Status epilepticus, the treatment is tranquilizers, diazepam or lorazepam. Lorazepam. Petit mal epilepsy, treatment is ethosuximide. Okay friends, I think this video is helpful for you, and if you like this video, please make a thumbs up and share to your friends. Have a nice day guys. Bye.